Hello, my name is Kathy Baldridge and I am a family nurse practitioner.
I'm Robin Burrow and I'm a family nurse practitioner.
My name is Raven Campbell and I'm also a family nurse practitioner.
My name is Becky Vincent. I'm an adult nurse practitioner.
And we are just a few of the nurse practitioners that are employed here at Incarnate Word Community Clinic in Alexandria, Louisiana. We serve over 600 patients a week through this clinic, through primary care and urgent care services. We have a collaborative practice agreement with a physician that is employed by Christus Hospital. He is not on site. He does not provide supervision. Supervision requires that someone would be looking over your shoulder and directing the treatment plan. With over 600 patients a week, there's no way that he could feasibly direct our treatment plans. Those treatment plans are ours for our patients, between us and our patients that we provide care for. And we provide an excellent service here. Our patients say that we provide an excellent service and we're happy to do it. So we're asking you to please vote for Senate Bill 187 so that we can continue to do what we do every day. There is no scope of practice change. It will just remove the restriction of the collaborative practice agreement.
My name is Tiffany Roy and I'm a family nurse practitioner. This is my clinic, Doosan Family Health Care. We are located in Doosan, Louisiana, which is considered a health professional shortage area. I have been a nurse practitioner for 12 years and opened this clinic almost 8 years ago. There was a physician in this building for over 40 years, but when he retired, the owner of the building tried to recruit another physician to reopen the practice but was unsuccessful. So the building was empty for 6 years. Since opening the clinic, we see on average 800 patients per month. 55% of these patients are Medicaid, 15% are Medicare, and 15% are indigent or uninsured patients. I do have 2 other family nurse practitioners that see patients right alongside me. We also have a diabetic educator who's in the clinic once a week to help service our patients. I also recently added a psychiatric nurse practitioner to our practice. We did this because we had such a hard time finding mental health providers for our Medicaid patients. As you can see, the services we provide in this clinic are crucial to the people of this community. We do have a collaborative practice agreement with the physician. This physician is not on site. He does not review our charts, he does not see our patients, and he does not oversee our practice. But if this physician decides tomorrow to no longer collaborate with us, or God forbid something happens and he passes away, our doors would shut down until we found a replacement physician to collaborate with us, which could take months or sometimes even over a year. So as you can see, this is the population that's affected by SB 187. And these are the types of clinics that are in danger of shutting down if SB 187 does not pass. So I ask that you please support nurse practitioners and vote yes for SB 187. Thank you.
My name is Mayor Kenneth Pickett. I've been the mayor of Mansura. This is going on my 3rd term. We have to realize in these rural areas, with all the state budget cuts and all the hospitals closed, how important it is to have the health care provided in this area, in the town of Mansura. Yep. Affordable health care is another thing, that the health care that provide where people, like you said, I have 2 senior apartments here in the complex. I have elderly and handicapped and disabled residents in the community that really do have the need for these facilities here in these rural areas are very, very vital. Because like we said, some of them can just walk. Most of them can just walk to the clinic. We're very proud of the facility we have in our communities. You know, I hear often from the residents, you know, from their feedback, how much it means to have that facility here in Mansura. Because we had a doctor at one time, but we don't have any doctor no more. Yeah. I think we need to talk to our legislators and try to ask that they continue to give us that support. They're just the quality of care, the quality of care that they have. And I hear it from my residents, you know, as well as not that, just that other referrals. They do an outstanding job on referrals, and I know that personally from my wife and my situation when we try to get referrals. You know, other than that, what would these people do in order to get the quality of care they need beyond this facility? This facility provides a lot more than just health care. It also provides referrals to other doctors and specialists that they need to see. That's very much demanding. Yeah. So, like I said, we need to ask our legislators to support, you know, keeping these facilities here. If not, well, what will we do in these rural areas? What will we do?
Hi, my name is Buzz Johnson. I'm a family nurse practitioner in Simmsport, Louisiana. I work here at Simmsport Family Clinic. I purchased this from a physician almost a decade ago who was trying to sell it for over 7 years. At that time when I purchased it, he was seeing almost 50 to 60 patients a day. To this day, we still see anywhere from 40 to 60 patients, mostly Medicare, Medicaid, and indigent patients. As far as our safety and outcome data in this clinic, it could be very easily proven, but it's also proven by the fact that our lobby is full every day, that our parking lot stays full every day. This community depends on us. Most of our patients walk to this facility. We have 2 local pharmacies that depend on this facility as well. There is a physician that does practice here in town, but I can assure you his parking lot and his office is just as full as ours. By removing the CPA, we remove our risk of us having to close clinics like this on the drop of a hat. If my collaborator dies tomorrow, this clinic closes. Will I be able to sustain business while I try to find another one? Probably not. It would be almost impossible. So I ask that you please vote yes for Senate Bill 187 so that we can continue to keep rural clinics like this open. This is not a new thing for nurse practitioners. We've been doing this for a decade. Many of my friends, many of my colleagues have been doing the same. Please vote yes.